Alrighty, I will call to order at 7 o'clock p.m. This is the Wednesday, January 21st, 2015 Finance Committee meeting. On the agenda for tonight are budget reviews with information technology, fire department, and library.
No, John?
No, John has a previous commitment. Unless you can't function without him, I can call him.
No, I
okay.
just wanted to be sure I remembered that correctly.
All right. So first, for this evening, we have information technology. Ms. Knox, come on up. How are you this evening?
I'm good. How are you?
I'm doing well. Thanks for coming.
Thank you for having me.
It's always a pleasure. So thank you for submitting your budget. Been through this a few times, which is great.
Yeah, this is my fourth time.
Fourth time, wow. Time
I'd like
flies
to
when
point
you're
out
having
a
fun.
mistake on here.
Sure.
This total of $186,000 is quite wrong. The numbers added up.
Okay.
So take that out. That's with the one-time expenses is $150,597, and without those, it is $115,097, which is actually less than last year.
Thanks for pointing that out.
Yeah, sorry about that.
No, it's okay.
Stupid Excel.
Yeah. So usual format, I'll ask you to walk us through your budget.
Okay.
Kind of walk us through what you're looking for next year. If there's anything in FY15 you have concerns about, feel free to discuss that. The other thing we do want to touch upon in these meetings is kind of like more of a future look. If there's anything you see on the horizon that may need to be addressed by your department. Okay, so I'll turn it over to you.
So you just want to go line by line?
Yeah, that would be great.
Okay.
Thank you.
Salary was level funded. IT services has an increase of $3,500, which mainly is for antivirus software at the DPW and the fire department. Maintenance contracts for the 2 Rico copiers that we've acquired at Town Hall. $500 for records destruction. We're hoping to go forward with having data destruction either every 6 months or as needed until we get caught up with some old record destruction. And there's $5,000 in there for townwide permitting. The online permitting, I'm looking at working with the state IT department.
Yeah.
So they are looking for a small town to do a pilot program with online permitting.
Okay.
But
Would that be like building permits?
Building permits, soup
Cool.
to nuts, forms, all of that. So the permitting on the budget may or may not happen.
Okay.
I'm hoping that.
And you said there was 5,000 in there?
There was 5,000 if we had to do something like that ourselves. But like I say, I'm hoping to get in on the with the State Department of Information Technology. They have an RFI out now.
Okay.
And they're hoping to know more about that late in the spring.
That's great.
Could I ask,
Sure.
which line is the $5,000 in? Either I'm missing.
It's in IT services.
Okay,
Part of
because the increase is only like $3,500, but that total.
That's the net, right?
Sorry, thank you.
Yep.
I thought that was the line we were on. So the actual $3,500 increase is for what?
The total increase of $3,500?
Yeah, roughly $3,500.
Yeah, that would include permitting, records destruction, copier maintenance, and antivirus software.
Antivirus, that's what I
Yep.
heard you say first, thank you.
And any other questions?
No, I'm good on that line.
Okay.
item.
And the next line's the website line, which has an increase of $2,700. $1,500 of that is for a website redesign. We're hoping to make it easier to navigate. Right now everything is buried pretty deeply, and maybe change.
Fine, it's old school.
It is old school. Click here, click here, click there. And give it a facelift and make it look a little bit better.
Okay.
And, move most of the things that people use all the time out to
Okay.
the front. And the acquisition of a board and committee database management module that the town clerk would be able to keep track of all the boards and committee members when their commissions expire, which would automatically populate the webpage. Residents would be able to log in and see what vacancies there are and apply for those vacancies.
That's interesting.
Nice management tool.
Yeah.
You know, another large Excel spreadsheet.
How much was that?
That is $1,200 annually.
Annually?
Yeah. There is no change in the communication line. IT supplies is increased by $1,000. $500 increase in just general IT supplies, toner, and general things to run the town. And we acquired a new copier in the town clerk's office, and this would be basically for toner. That's an estimate. I think that's a little bit high, but I'm not really sure
Okay.
what the usage is going to be on that.
Yeah, did the clerk get something similar to the one that is in the main office here?
That's also included in here.
Okay.
Yeah, and that didn't change from last year.
So the total increase of 1,000 is for toner, basically, and machine supplies?
Yes. And other charges.
Sorry.
I added $500 there for training for employees. Hoping to do some security training townwide.
What kind of security? Just curious what that would entail.
Oh, all kinds of security, everything from computer security to, leaving clean desks.
Okay.
Not leaving things lying around, building security, all of it.
Okay, great.
And hardware, general hardware repairs and failures. Unanticipated, when printers die or computers, things like that.
Okay. We can circle back. I had a question and I lost it. Sorry. You want to walk us through the one-time expenses?
Yep. First of all, most of these expenses I've submitted to the Capital Planning Committee, but I don't think they voted on anything yet.
Okay.
So I'm hoping it will be either there or here. Upgrade obsolete equipment. We're on a 4-year computer replacement plan, and there are 6 that are up for renewal this year. I would also like to start buying software licenses for Microsoft Office. We have many old 2003 licenses, 2007, and we really need to get in on the Microsoft plan where we purchase the licenses.
Do they have government licenses?
They do. They do. But it's still in the area of, for Office Professional, it's about $400. Digitizing records, I think this comes up every year. This will be the 3rd year. But the town clerk is anxious to get in on this, and she would be a really good place to start.
Is that a firm number or just a wild guess?
That number was firm at about $15,000 to get started with some of the town clerk's record a couple of years ago, so I added a couple $1,000s to that.
Is that a service or would there be?
It is service and storage. So basically, someone would come in and analyze the records that are there. They do everything from taking them out of the file cabinets, taking the staples out, scanning them, and storing them and indexing, so for easy retrieval. So, and they charge you based on like how many file cabinets or how many boxes.
Is that like a carbonite storage or or something?
Yeah, it could be. The service that I was looking at is government storage approved.
Oh,
Okay.
Yeah.
So if the storage, is that going to be an annual fee?
There will probably be an annual fee on that.
You don't know what that is?
I don't know what that is. I can find out. Like I say, that's,
That should be at least quoted in the original 2-year-old estimate.
yes.
Well, that's what I was wondering, if 15 is to do the actual work.
This was to get it going for a year.
Right, so
Um,
2,000 might be annual fee.
I think Cindy was just taking a wild stab at the 2-year increase.
Right.
Or the increase over 2 years, rather than quoting a new. But we do need to find out what the annual is going to be, so we can plan ahead.
Yeah, I'll give them a call again and talk to them
Thanks.
in
That'd
more
be
modern
appreciated.
times. And the third floor has about 6 printers up there. So we're hoping to, as those run out of toner or die, get rid of them. They're expensive to maintain, and put in a small multifunction printer, copier, scanner, fax upstairs that everybody up there would use. It would-
There's 6 there, you said?
There are, yeah, at least. There are
I
at
thought we got
least.
rid of all the extra, we got rid of the ones that nobody was using. 'Cause
Right.
that's the
Yeah.
ones that were still out.
Right, they're still there.
And those went off to the Smithsonian, right?
Yeah, it's
Cuba. You should see the
Down-
cars
down on-
that they're driving.
Groton Harvard Road. Yeah. So there are more printers up there than there are people.
Yeah.
And-
Exactly.
And we were down a couple people, so they're, so we're hoping to get rid of that. That's about $4,000 for a small color unit. So the computers, the printer for the third floor, the software licenses, and the records digitization are also on my capital planning budget.
Okay.
Okay.
So those may come out if they're approved by capital? Okay, great.
So the last thing that I have here is a one-time expense that is not on my capital planning budget, is a cell signal booster for the fire station. Verizon service inside of the fire station is weak. You can't really go down, you can't go into the basement where the wiring comes in and talk to any vendors. In the data center, there's no service in there. You have to step out into the hallway. And so the server is in here, there's no cell phone service. The ambulances use Verizon Air cards, and they have limited to none
Okay.
connectivity while they're at the station. And that's starting to be a little bit of a problem.
You know, if we just tore that down and built it up higher, put a big ramp on it, get a faster start.
Hindsight's 20/20.
Okay.
Even 3 or 4 people would have been nice.
Sorry, Polly.
I didn't mean to interrupt you. Are there any reason why the signal booster wasn't included in capital planning with the other items?
It didn't come up until afterwards. So that's basically putting an antenna on top of the building, which would boost the Verizon signal there.
Okay. That draws it into an antenna inside, correct? Like, is it inside the building? That kind of
Yes.
acts as a relay? Okay. So the one question I just remember what my question was, the new copy that we have in the clerk's office, are you seeing a decrease in the amount that we're spending on toner as a whole?
Not yet,
Not yet?
not yet.
Okay. Do we need to get rid of the 6 upstairs before we see that?
Yeah, we have denied several requests for new printers
Good for you.
this year. You know, a couple of them have failed, and you know, people think they're automatically getting another one, so we're, you know,
Good.
reducing those.
And majority of the town offices are going through you for all of their IT needs, at least whether it's from
Yes.
an equipment perspective primarily?
Yep.
Okay, so there's some standardization over what we're implementing?
Yes.
Excellent. Good. I don't know why I do 30-minute increments. I think I've had one that went 30
Because
minutes.
if you put in for 10, we'd be.
We'd be here for 30, yep.
Yep.
Communications committee, just jumping down to the bottom real quick, $700.
Yes.
it hasn't been used in the last few years, is that still?
It hasn't.
Right.
We do have we have some plans for it this year and
Okay.
next year.
What generally does that get used for?
I've actually never really used any of this, but
Okay.
I know we can use this too as part of our website upgrades. And the laptop that they're using in the APAC room needs to be replaced.
Why wouldn't APAC's budget cover that? They're privately funded by Comcast.
I don't know.
Should, APAC's budget from Comcast should cover that, not us.
Yeah, when they were in need of one, we had one, you know,
Mhm.
that we gave to them to keep in the room, but it's falling apart.
So they should
It's about
use
as
their
old as it can be.
budget from Comcast
Yeah.
to buy themselves a new.
None of the communication money is spent without any approval by the IT committee either.
Okay, yeah. To Pauline's point, if you could push back and
Okay.
see if APAC can get the funding for that through Comcast.
Or they're free one, I mean, they got a lot out of Comcast for the contract.
Yeah,
Oh, okay.
Even though monopolies are supposed to go illegally.
hey, keep commentary to yourself. Though we all
Well, no, I think
believe, though we
that's
all
a
believe it.
fact.
Yeah.
I think the other thing that money's been used for in the past, before my time, are for things like townwide mailings, when there was
Yeah.
a communication committee.
Yes.
You know, we do a lot of, all that I'm aware of. I don't think we do any townwide mailings anymore. We do it all on our social media and
Yeah.
on our website, so we'll make that better.
Thank goodness for Facebook.
Yeah.
Is there an actual communications committee that you're aware of?
No, it's disbanded. It turned into the IT committee.
Maybe we could suggest that that line item just be absorbed into
Yeah,
information
I agree.
technology and be done with it.
Yeah,
Yep.
one less department to handle.
I mean, there hasn't been anyone on a communications committee in at least 5, if not 10 years.
Oh, okay.
That'll cover $700, it'd be $5,700 website cost.
Yeah.
So I see, we're redoing the town website. The permitting thing, I think, is very long overdue and very well thought out. Is there anything over the next 2 or 3 years that you could see as potential hurdles or impacts to your department?
Mostly what I see now is, every 4 or 5 years, we're going to have to replace servers.
Mhm.
Every 4 years, we're going to replace desktops. So those things I think are going to be an annual expense, depending on
Rolling.
how many there are. Right.
Mm.
This year there are 6 that fall into that category.
Yeah.
If you wait too long, they just all fall apart. And then it becomes urgent and people,
Yeah.
may lose things. It's much better to do a rollout
Okay.
while they're still functional.
Does the laptop replacement generally falls into the category
Same
for
thing.
capital, though? Does computer replacement falls into does that qualify for capital planning?
It has before, so that will probably end up, as an ongoing capital
Okay.
expense. But I know when I was at the capital planning meeting, they suggested putting these things into the operating budget.
And then that's because I know, for
Yeah, so
example,
I
for the
don't
police
know.
department, we have a cruiser replacement in the operating budget, so it
Mhm.
doesn't go through capital every year. I guess, I know you're looking to replace 6. If you just put some thought into maybe an annual amount that would work for you, just so maybe we can
Every
start
year.
rolling that, yeah.
Right,
We can
just
actually start
a
rolling
fixed
that
amount.
into the budget, yeah,
Sure.
that would be great.
We replaced all of our servers the same year. So,
Yeah.
it may, and those usually you can get 4 or 5 years out of.
Okay.
So unfortunately, that will all happen at the same time again, unless we could roll those out over separate years.
So we'll have a bake sale, we'll be fine.
What?
We'll have a bake sale.
Big-
Yeah.
big sale.
Server
That's the
sales.
answer for everything.
If we create a line item specifically for hardware replacement, whether it's laptops, desktops, servers, et cetera, what is it used annually can be encumbered for the following year or rolled over? Yes?
I mean, hardware's in there, right?
No,
Oh.
it goes back to general fund at the end of the year. just would roll into free cash if we don't use it. Same thing with the cruiser. If we put $38,000 for the cruiser down, I think the last purchase was $34,000 for the
And maybe
cruiser.
we
So the
borrow items as opposed
yeah,
to
so the
loan.
4,000 just went back into free cash.
Right.
Yeah, I know the borrow items accrue
Yeah,
over
yeah,
over the
but
years. But
I may be thinking something different. It's been
Okay.
2 years since I've actually sat at this kind of table.
It's all right. I'm running on fumes myself mentally, so trying to keep it all straight. Any other questions for Ms. Knox? No? Any questions for us?
No,
No? All right.
okay.
Thank you very much for your time.
Thank you
Appreciate
very
it. Always a pleasure.
So that- Thank you. I think it's only wages that can be encumbered from one year to another, and it's only when there's, I know I've seen it before, and
Okay.
it's small items usually, and it's usually, I think, when it's the end of a week, you get the end of a fiscal year in the middle of a week or something like that. I can't remember
Oh,
how it
yeah,
was
the
explained.
overpay periods.
Yeah.
Yeah, overlapping pay periods with the fiscal period. In the private sector, we call that an accrual.
I think that's what was confusing me.
All right, up next we have the fire department. Mr. Chief Pedrazi, if you want to come on up. And a guest.
Yep, Captain Paul Fulbrum.
Captain, how are you? Nice to meet you.
How are you?
I'm Scott. We have Mary Ann, Pauline, and Chris. Welcome. How's everything going this evening?
So far, so good.
Quiet day today
Uh,
compared to some.
yeah, we
Yeah,
still.
you think it's quiet, but it's
Yeah,
never
still,
quiet.
we went out for a few medicals.
Yeah.
There was quiet. A couple
I
of
have
spaces.
updated stuff, because I didn't, the
Okay.
ambulance budget wasn't done when I handed my
Alright.
stuff in.
Do you want us to discard what you previously
Yeah.
submitted?
Yep,
All right.
throw away what you got. And
Throw everything that's in here out.
It's like-
I made a whole new packet just so that we would be mixing and matching.
That's good, because now I have no paper.
Thank you.
I usually use it for something. A little chilly.
Yeah, it was,
Yeah, can one of these up next time?
Yeah, sit on them or something.
and as you can see, we don't have a color copy of it.
Yeah.
You know, IT was here, you could have asked.
Yeah.
So this is updated as of today?
Yeah, as of today. Yeah.
So,
Yeah, the ambulance, like I say, the ambulance budget was not added in, and the big spreadsheet that I have with all the salaries and stuff, I found a couple mistakes in that yesterday that added up to about $600,
damn
so.
that Microsoft Excel.
Yeah, I don't know what happened. There was like 4 in a row where I screwed up the numbers.
No, the computer screwed up.
Yeah, well, I guess it was me. Because the computer usually does it right. So, I don't know, how do you want to start?
It's up to you if you want to just go from the front to the back. If that's easier, we can work it that way, or I'll let you lead the conversation.
Well, I don't know, do you want to do the survey thing? Or did
Yeah,
you
we can
guys-
do that first if you want. Like I said, whatever's easier.
That didn't change, right? So I can keep
No, the
color
survey
copy?
didn't change at all.
keep
Yeah,
the
you
color.
can use the colored one. Yeah, I just went fancy on that one, so you can see my replies. Anything that I need in the next 2 to 5 years is in my capital plan, and I have a 10-year plan. I know they only ask for a 5, but I go out 10 with mine. It's not that hard to do, you just keep rolling along once you got it. The only thing I'm asking for that we're gonna need, that, you know, that's right now in the next 2 to 5 years, is the rescue boat. And that's an inflatable boat that we have. I had asked for it last year, it's old. Yeah, it actually, I think it's actually older than that,
Yeah, it
and the
is.
town didn't pay for it when we got it, so it actually owes us nothing. But right now, it deflates itself, so, you know, you have to make sure it's pumped up all, no, I'm serious.
Yeah.
Temperatures
I mean,
too.
it just- Yeah.
It does,
And
take it out in the
deflates
cold.
with temperature, just like the Patriots
Yeah.
footballs.
Yeah. It drops. It does.
And,
Do you have someone
yeah,
in the back with a little pin?
And we have, you know, it has handles that are glued onto it, and the handles that won't stay glued on anymore. We got the, you know,
Yeah.
correct epoxy and all that stuff, but your kid's hard to carry now, when you gotta carry it down to the water's edge. You know, it's on a trailer. And the trailer is actually adjustable. I didn't realize that when we were asking for it last year at the capital planning, but the trailer adjusts width-wise and lengthwise. So whatever we get for a boat will still fit, and the trailer's fine. I mean,
Okay.
you know, if it needs tires, that's nothing. You know,
Right.
we have to replace the tires. And the motor that's on the boat, when we did a little research on getting a new motor, you can't buy a two-stroke motor anymore because of the emissions from the
Right.
two strokes, and the four-stroke motor is a lot heavier, and we can't lay it down,
That's
the
true.
four-stroke one. So, and we may need to lay it down when we get the new rescue truck, the way we have it planned out. We may have to look, we may have to, instead of
Okay.
leaving it on the boat, we may need to lay it down, so we're not gonna change that. And it still works fine, you know, and it does what we want.
Yep.
Two guys can carry the motor and the boat when it has handles.
Yeah.
So you don't need a new motor for it?
No.
or you-
So I'm just looking for 5,000 in my
For the
budget
boat
on the
itself.
one-time expense for the boat itself.
All right, and you're looking for that this year, correct?
Yes.
Okay.
Yeah. So we took it off, it's actually still on the capital planning thing that you see there
Mhm.
as an $18,000 expense. But even to get it up, I had to add in some ice rescue equipment into that 18,000 when I was looking at the capital planning. And that was before we got the bids in for the new rescue truck, and when the bids came in, there was enough money left over to buy that ice rescue thing that we wanted out of the
Okay.
budget for that, so I don't need the money for it. That's why that looks like 18,000, so there was other stuff added in there.
Okay.
Does the ice rescue thing look, sorry, does
No,
it look like
please.
that?
The one we got is the one you saw on TV the other day.
I was gonna say, it looks like
Yeah.
a catamaran that
Yeah.
doesn't float, or,
It does float though.
It does float,
It's
though.
it's actually just made just like a Boston whaler. There's two pontoons and they're filled with
pontoons, that's what they
styrofoam.
look, right?
Yeah.
So you could cut the thing in half, it would still float.
They
It's
rescued
pretty
a
neat.
kid
It's
who
my
was
favorite
holding on
video
a
from the
hockey
boat show as a
stick
kid.
Yeah,
Yeah.
in Hingham, I think it
Yeah.
was.
yeah,
Yeah.
it was, yeah. So we have the same, we just purchased that
And
last
another
week and
town
had the
used
training
for
on
to
it.
rescue a dog.
Yeah,
a couple
yeah,
weeks
they go
before.
for, you know.
Yeah,
Yep.
So
there's been
we're
several
getting-
around and,
We actually have
and
it.
Yes.
when we called the company to get the sizes for it, because it's gonna fit in a compartment in the rescue truck, so everything for that truck is all planned, where it's gonna go, the sizes, and what's gonna fit here and there. We found out that they're not making them anymore. And the guy only had 3 left, I guess. They've sold all what they figure they're ever gonna sell, I guess. You know, there's only a limited market for them, and it's been on the market for a long time, so we actually went and got that. We figured we can use it this year.
Pretty much
anyway,
last
so-
forever. They're very durable,
Yeah,
so it's
yeah,
not.
it's something that's never gonna wear out.
Good.
Hopefully you won't have to use it.
Right,
No.
that's it. Yeah.
No, but
Thank
you know, yeah, you hope not.
Yeah.
But the thing is, it's safer than what we were using before for the rescue and the person that, that you're gonna rescue. Thank you. So, that's that. The facilities, I'm asking, same thing Cindy just said, the cell phone signal booster. And we had a lady come into the station to tell us about it, but that $4,500 is not an exact price. That's a guess. They don't know exactly what you need until they come in and do a survey, and the survey costs $250. And I wasn't gonna spend the money for the survey and then not be able to fund the project.
Right. No, that's understandable.
But that is needed. I mean, even sitting in my office, a lot of times I drop a call, and a lot of people call me on the cell phone, you know, and
Yeah.
you know.
I agree.
It's just, it's more, and like Cindy said, that new ambulance program that we have runs on a secured Verizon line. And it also works on wireless, so the wireless isn't secure outside the station, so it has to work on the Verizon. It works on a secured VPN on the air card, because of, you know, transmitting people's social security numbers and everything else over it. So that would help to have that working when they come in the station. Also would help to have it working constantly. Because what happens sometimes when it swaps from the VPN over to the secured wireless in the station. Sometimes they'll drop a time or something out of it, and the guys get mad. So it would be nice to have it working.
Correct.
The operational equipment of technology facility maintenance that we're postponing. Eventually, we're going to get flooded again. We have some stopgap measures, what I call them. We were able to get money from FEMA after the last flood for the door dams that go in front of the doors, and we raised up the generator. There's still issues there. The transformer is still vulnerable. It's low. It's not as low as what the generator was before, but it's not up to the 500-year flood mark, which is what FEMA wants everything up at for a facility like that. There's going to have to be some money spent.
What would you anticipate as a permanent solution?
First of all, we need to buy the lot in between.
Yeah, I know
If
that.
we have to buy
Yeah.
that property, there's two reasons why we can't do anything for that, with that, unless we own that property. That property has a right-of-way that goes with it, that goes right down the center of the parking lot for the fire station. So we can't take and put a wall at the end of our property to keep the
Okay.
water out, because they have to have access to that piece of property. And the other thing that we need that property for is for water storage, because what I'm proposing, I've talked to Mark Wetzel a couple times about it, and there's new engineers working on it with him. When you block flood water, you have to have a place on the same floodplain that you own to put the water that you're pushing downstream. So between part of that land and part of the land at the DPW that's on the same floodplain, we think we're going to have enough, they call it compensatory storage, to do that. But we're proposing to put some kind of a concrete barrier that's at the 500-year flood mark, which if you go to get a reference for that, look at the generator, if you're over at the fire station, and that platform is at the 500-year flood mark. So we have to have a wall with the retaining wall that's there now. It was not meant to keep water out. It was only meant to keep the dirt back in the parking lot. It's a retaining wall, but that could be added onto the top of it, and then carried down further down the property line. And there's a couple other things that have to happen, but Mark thinks that we may be able to engineer it ourselves, which would save us a lot of money.
Yeah.
But we have to buy the piece of property, so there's going to be some money. It's going to have to be expended.
Are there any ongoing discussions still on
Yep.
that?
There is.
Because that's been discussed for a couple of years.
Yeah, quite a few, actually.
Okay.
Yeah, even before we had the flood. We had the first flood in 2007, the year after we moved in there, and we kept the water out. And after that, we built an ad hoc berm, a lot smaller than the one that's there now. When the fire department built that, we really didn't have any support from the DPW at that time. When Mr. Madigan was here, he didn't want to be involved in it whatsoever. So, we took went through the Concom and we built that berm. And when we had the flood, it held for the next year we had a flood, and it held fine. In 2010,
That wasn't a flood, that was a monsoon.
that was, Dan was the DPW director, and they were helping us make that thing higher the night of the flood, and the suction from the loader going back and forth in front of it, because the water comes up through the parking lot too. You just can't believe how this comes up. So the water that comes up through the parking lot we can handle with pumps, but the suction from the loader pulled the dike that we had down. And I don't know if you've ever seen anything like it, but it was like the kid that has his finger in the dike. There was a little teeny bit of water coming through, and then like 10 seconds later it was this big, and then a minute later there was a 4-foot hole there, and it was just, couldn't stop it. It was horrible. And we're lucky no one got hurt. We had guys, we didn't really move anything out of the basement because we knew we could keep the water out. We had this big wall there, that was, and people tried to go in there and take stuff out when the water was coming in, and it was ugly.
No,
So
I'm
we
sure.
need to prevent that from ever happening again,
Okay.
somehow. The staffing levels, last year we were able to get a full-time position for fire prevention, which has helped out a lot. Doing the inspections, it freed up a lot of time for me to do some other things that need to be done. And it helps during the day with coverage. We have an extra guy there, 10 hours a day, 4 days a week. So it really does, that one person makes a big difference. But, you know, in the future, you know, I was looking at a deputy chief's position last year, and, you know, for several reasons that didn't work out. Some of the stuff was that the money wasn't enough to have somebody from the inside take the job. They're, you know, a little scared about security of the job, comes out of the union. So there was a lot of issues, and there was some other stuff that, because we were in union negotiations at the time, that there was a lot of things that couldn't happen for the town. But I think at some point in time, next 2 to 6 years, and I'm 56, I'm not staying until I'm 65. But we gotta bring somebody in, if you know, either we gotta get somebody from the inside and get them trained. I've been trying to bring the captains, you know, who's ever working with me to these meetings to try and get them, you know, into the loop on this stuff. But it's really not their job, you know, to do this. They're very receptive to it, you know, but we're gonna have to look at that at some point in time. Because, you know, to bring somebody in from the complete outside to run a department like that is not, I can't say it can't happen, it could happen. I mean, you know, there's people out there that could do it, but yeah, I think you're very rare to find the right person to just come in and take over. I mean, even when I took over, I was doing a lot of the stuff already, helping the chief, you know, with the budget and payroll, and, you know, I developed pretty much the payroll system that we have and all that stuff when I was working down there. And when I took over, it takes a long time to get going, and I had 20 plus years already, you know, in the department full time. So to bring somebody in from the outside, I've been chief going on 9 years. Yeah, it's my 30th year full time, and I was on the call department for 9 years before. So I got
Got a little bit of time in.
Yeah, this is going to be my 39th year.
Another 9 years should be nothing.
You know, it actually has gotten a little easier each year with the, you know, with the budget and stuff. Now it's just, you know, once you develop it and you just plug stuff in, you know, and you have a big spreadsheet that you do.
Yeah.
You know, and I don't, you know, I don't do it in a vacuum. I work with Lisa doing it, and, you know, she checks my stuff, and, you know, we do the ambulance budget together. Some stuff she has to get from me, some stuff I have to get from her to put it together, but, you know. So, I mean, sometimes you're gonna have to look at a deputy chief. I mean, the stuff that we're required to, paperwork that we're required to do for the ambulance, for, you know, for DEP, for the fire marshal's office, it's just, every year it gets more and more complicated.
And a portion of your salary, a portion of a deputy chief position doing paperwork for the ambulance would be covered by the enterprise fund, correct? Okay.
Yep, 15% of my salary, and actually 15% of the daytime guys is out of the ambulance enterprise fund. And 33% of my secretary's administrative assistance is out of the ambulance fund. 25% of all the full-time guys' salaries, including 25% of the overtime, comes out of the ambulance enterprise fund. And then the utilities part is like 5% utilities. You know, all the fuel usage comes out of it. I gave her the up-to-date fuel numbers today. And that's all in the indirect costs that goes back to the town. So the grant question.
Can we go back to just the last bit on question 5? Fire departments anticipating retirements requiring payout of vacation.
Not this year.
Yeah, you're tracking. That's part of that like magical like $1 million that I think is between you, DPW, and fire. Okay, and you track that every year with the liabilities.
We report it to Lisa.
Okay.
And yeah, she tracks it.
What's the time frame that you update that and send that to her?
She wants it, you know, as of June 30th. So
okay, so that's what the fiscal year.
Yeah, end of the fiscal year.
I have a couple of things on staffing I just want to flesh out with Bob.
Please.
There are a number of times during the day, and not so much at night, but certainly during the day, where you can't get the call firefighters in because they're working.
Yeah.
We've got 2 ambulances.
Yep.
Often one is always going to another town for support or ALS or something like that.
We had 3
And-
double calls yesterday.
Right, and that leaves one ambulance with
Mhm.
one driver.
Well, with 2 now, with the full-time guy there during the day.
And that's where I was
Yep.
going. So you've always got someone there
Yep.
during the day, but
Right.
there have been a couple times in the last couple of weeks where you haven't had anybody. I think you manned the station once when everyone else was out,
Yeah.
or you actually ended
Yep.
up being the first one out on call because everybody else was somewhere else.
Mhm.
You know where
That
I'm going with this.
Yeah.
Would it benefit the department and certainly the town to have added staff, even, if we don't add it in 1 year, we add it over a period of time and
Yeah, I
plan
mean,
ahead for it, and
I-
another shift of 3?
Well, yeah, not another shift at 3. We have 4 shifts now, so you'd add, if you added another person to each shift,
That's what I mean,
yeah.
one person per shift.
yeah, there would be a total of 4 people. Yeah, I would never say no to staffing. I mean, we could use more staffing, there's no doubt that we're still scrambling around all the time. The thing I can tell you is we have never missed a
Not
call.
called, right.
Never had not been able to get the ambulance out. We've never had a time where we've had to call another town to do our work. There's a lot of times
Never.
the other towns have to call us because they can't do their work. But we've never had to do that. We've always been able to, to get by. You're worried with both ambulances out and, all 4 of the daytime guys say on a calls. If you had a fire, it's gonna be catastrophic. It happened in Ipswich a few years ago. They were out on an ambulance call, and a lady and a kid died in a fire. It could happen here.
Especially with the population increase over the last few years.
Exactly.
Yeah, the population is increasing. We have an elderly population. If you hear the ambulance quote, it,
It goes to
Yeah.
one location predominantly, a lot.
Yeah, you go to National Park a lot, yeah. We go to Apple Valley, even though it's attached to the
I
hospital.
think that's the
they don't.
second
Yeah.
most popular.
Yeah, they don't, they can't transport, they're not set up to do that, even though there's a tunnel in between the 2 buildings. We thought when they built that place, we'd never have to go there. Yeah, we were so happy that they put the tunnel in, it's like, oh, this is
Yeah.
great, they can just wheel people over. They
Yeah.
can't do it, they're not trained to do it, they don't have the staff to do it.
Ah,
It's actually against the law for them to do it. So we transport.
yeah. How many, just curiosity, how many mutual aid calls does the ambulance go on a week?
Yeah, well, I don't know, per week.
Yeah.
I could probably tell you if I had, bring that data with me.
Yeah. I'm just curious because, I understand,
I know
we rely on
I could-
each other, but
yeah.
I know from our conversations
not
over the
really-
past, it seems
A lot of
like
the
because
calls
we have
go
the
on
2.
They're not really mutual aid calls, they're ALS
Yeah, that's right.
intercepts. So they have the staffing, but they're not at the correct level to be able to do what the state requires. So they're required on certain calls, chest pain, shortness of breath, allergic reactions, difficulty breathing, severe trauma. They're required by law to call a paramedic service. And so we have contracts with all the area towns because if you don't have a contract, you can't get paid because only one ambulance service can bill. So the primary, whoever transports, bills, and then they pay us our portion of the bill.
And sometimes one of your guys rides along with their ambulance, sometimes you transport,
Yeah.
depending on what the severity.
Usually our paramedic would get in their ambulance and go to the hospital in their ambulance. 'Cause
And a lot of
they're
times
the
you're canceled
transporting
en route
ambulance.
too, which
Yeah.
seems to be a good.
That happens a lot. It happened today, this afternoon. They had a call over in Groton. It was supposed to be difficulty breathing and they got canceled, before they got there. So it happens quite frequently,
Okay.
but they're required to, and we do a lot to Shirley and we do a lot to Groton. Those are the 2 biggest ones. And-
Harvard has a contract with another company,
Yeah, and
as does Littleton. I think.
yeah, Littleton doesn't call us very much, but we went there the other day.
The other
They
day,
called
right.
us. They still call us. We had to go to UMass yesterday morning because
Yep.
somebody ran into the back of a dump truck and was severely injured. And they couldn't get their paramedic service, so they called us and we have to transport to a level 1 trauma center. The state's dictated where we can bring certain
Yeah.
types of injuries. If somebody's having a heart attack, we have to either go to Worcester or Lowell General or Leahy, someplace that has a cath lab.
You had to go to
certain-
Emerson a couple of
There's
weeks
certain
ago.
heart rhythms that they can detect from the cardiac monitor that we have, and when they see that heart rhythm, they have to bring it to a place where and they don't even go to the emergency room. They wheel them right up to the
Cardiac.
cardiac cath lab, and they and it saves lives. You know, they go right to the right place instead of going up here and then going, oh, we got to get another ambulance to transport you to you know, to Lowell or to Worcester, you know, which could take an hour for them to get another ambulance in there to bring them, because it's got to be at the paramedic level to be able to transport that person because they've got IVs in, and you know, so we're, you know, a trip to Worcester is, you know, 2 hours, you know, by the time you
Round trip.
Right.
by the time you get over there and you know, unload and get back, it's a couple hours.
Yeah.
So they get the car
Yeah,
back.
but that doesn't happen very often. That might happen once a month or so.
Okay.
Would you need to add all four
At the same
at
time?
the same time?
No.
Or could you?
No, you could step it in. Yeah, I mean, you could add one person on a shift, of course. You know, everybody else is gonna be jealous because they have an extra person on their shift to help do the work, you know, but whatever, it is what it is.
You guys
Yeah.
would be jealous of us. They all work together too.
We do, we get along well when we work together, and you have to.
What would the estimated cost be for a first year?
I had that last year, I think it was
Yeah,
around 59,000, something like that,
60,000?
yeah. That's for first year with the guy, with a paramedic.
And you'd have to go through the union on it too.
Well,
Not that
you
they
don't
would
have to
say
go
no.
through the unit. I don't know why they would oppose getting more help.
Exactly, yeah.
Yeah.
Anyway, that, as you know, that's always been a
Yeah.
pet peeve
I-
of mine, and I'd
yeah,
certainly
I-
like to see the.
I would never say no to more help. You know, right now we're getting by.
Yeah.
You know, the way we are, like I said, we're able to do the job, and we do the job well. You know, it's not like we're just getting by. We,
Mm.
Mhm.
you know, we do a good job.
Yeah, you do. Great. Anything else on question 5?
Well, that's,
No.
that was my big one, thank you.
The grant question, all the grants, I mean, we apply for and get many grants.
Yeah, you guys do a great job with grants. You really
We
do.
work together
It's
as a
impressive.
team. You know, there's a process that you have to follow, and if you don't follow the process, you don't get the grant. And, you know, we've figured out some of these, you know, you don't get them all the time, but at least we make it through the computer scoring all the time, which,
Mhm.
you know, if you don't do things exactly the way they want you to do them, they don't work out. But, yeah, I mean, I don't think a grant writer would hurt us. I know Devon's has one, but, I mean, we're able to do the grants that we can apply for, that there may be some out there that somebody else could help us with. I would never say no to help.
Okay.
I mean,
I know that
You know,
came
you
up
can have
last
somebody
year. We
read over-
talked, and
You can have somebody read your narratives over, you know,
Yeah.
that is an actual grant writer that might know one or two words in those things. I think it
Right.
makes a big difference.
Okay.
So I wouldn't say no. I mean, I don't think they'd actually be able to come over and, you know, sit in front of the computer with us, because it's all statistics and, you know, all that stuff that has to go in there to make it go through the computer part of it. You know, and, you know, if you had more funding, I would, you know, would always be helpful to have more people. The equipment that we have is adequate for the town. I mean, we don't need to have 3 pumpers, you know, but we need to have 2 that work. You know, we don't need 2 ladder trucks, but we need to have 1 that works. So, you know, it's gonna be replacement, and not adding stuff. You know, the emergency medicine field, they change stuff all the time. And, you know, the paramedics work under, well, actually all of us that are licensed EMTs, whatever, we work under the medical director's license at the hospital. And they're forever just going and saying, well, I want you to do this now. I want you to attend 3 meetings a year. I want you to attend, you know, and you have to pay people to do that stuff. And, you know, for years, we never paid for medical control. The doctor has to oversee our program, and they always did it for free. When Stewart took over, they wanted to be paid for it. And so we pay them $5,000 a year now to support the medical control, which we have to have. And talking to some of the other chiefs, that's a drop in the bucket to what they pay
Really?
down near the city. Yeah, so we're still getting a good deal for it. Even Emerson and Lowell charge quite a bit more than what Stewart is charging us. So I would expect that probably to go up at some point.
And it's a requirement.
Yeah, we have to have it. We can't have
Yeah.
we can't
Can't
run our
operate
ambulance
without it.
program without it. Right, the state comes in and we have affiliation agreements with the hospital
Right.
that the medical director has to sign off on for the replenishment of the drugs, you know, for the oversight on the EMTs, for the QA, QI portion of which, you know, they take the run sheets. If it's a certain call, they want to take it and they want to make sure everything's done right on the run, they review those things. We're actually, tomorrow night, we're having, they do it once a month, they call it an M&M rounds, and we've been swapping between Groton and our station, where the doctor comes out and he'll go over like 3 cases that happened last month. 3 specific things and why they do what they do, why we do, what we did right, what we might not have done exactly right,
Okay.
a learning type thing. It's all done, confidentiality. But we got to, the medics have to attend 6 of those a year, and that's something that they just, you guys have to attend 6,
Yeah.
or you're not going to be able to practice under my license anymore.
Okay.
So that's the kind of stuff that pops up, and they don't have a time frame for government, for municipal budgets.
No.
That medical director's fee, I just paid it in October, and they sent me another bill because their fiscal year's on a different fiscal year than what ours is, and it's still sitting on my desk. I called the lady up with names on it. She never called me back, but I told her, we can't pay this bill until July 1st. That's when you're going to get paid, So they just don't have the same,
Right.
They don't know the
Okay.
rules of the municipality. So I would expect things up there to change.
All right.
It's it on the survey.
Anything else on the forecast survey? No? Good. So the capital plan? So you mentioned the 18,000 is
Yeah,
to be
that
reduced?
can get wiped off.
Okay. So ambulance 2 are being replaced
Yep.
in the fiscal year, and then a fire prevention car?
Yep, that's what we're looking for.
Okay.
We haven't heard back from the capital planning committee yet,
All right.
unless Mary wants to tell me.
Tomorrow.
But I know we have money in the ambulance budget for the debt on the new ambulance. So.
Okay.
It should come in lower than the 225. I've been getting some bids on that. And we're trying to do it the cheapest way we can, But, it still has to go out to bid. Unless the Fire Chiefs Association actually had a program where they pre-bid all these things. But the bid on the ambulances ran out, and I don't know when the next one
Oh, okay.
is coming in.
You're going to be able to keep the third one?
No, we don't have room for it. Yeah, and they don't give you crap for them when you trade them in. I got an estimated value of $5,000 for them. Yeah, it won't go for $5,000. I can tell you that right now. We'll go out to bid and sell it to a private ambulance company or something. We'll get a lot more than that.
I'll give you $5,000 for it. Help with my commute to work.
I tell you, I wouldn't trade it in for that much money. It's a joke.
Yeah.
Just for curiosity's sake, is there more ROI in having our own ambulance service rather than a private service?
I think you get a lot better. Service. A lot of these towns have had private services come in. They promise you the boat, they're going to come in and do it for nothing, and then they're never there. MedStar has a unit at the hospital that is an ALS unit, and that's the reason we go to Harvard. Because
I thought I knew where you were going to go with
because
that.
they're never there, so.
No,
Yeah, I mean,
yeah,
it sounds really good. They'll come
exactly.
in and they'll sell you a bill of goods, and then you won't get the service that they promised you. They're going through that in Worcester right now. MedStar just took over that area, and they're having a lot of growing pains.
They were just leaving town when I was going up the hill to the hospital.
And
without the lights on. You don't know
Yeah,
where
so
they're at.
they're going to do a they're
do
going to make money.
transport.
They're going to
Yeah.
do a transport somewhere, which they're not supposed to be doing.
Plus, we have the enterprise fund, so the
We do, and it's-
ambulance actually, the fund,
Right.
it's always been in the black. It's
No, it
never
hasn't
needed
had a
a
subsidy
subsidy.
yet, but it's
So they're able to.
working
adjust
pretty
the
closely
age.
though,
Yeah.
right now. We had a bigger subsidy than what we did. You'll see when we get to the ambulance that we have to use some of the money out of the.
Yeah.
Well, that's what it's for, though.
No, I know.
Yeah.
But we have to use some of the surplus money, and we have the last 2 years. And, I looked at raising rates, and the problem with the raising rates is that 40% of our customers, Medicare, Mass Health, subsidized, and you can charge them
Only so
$1 million,
much.
and they're going to pay you $400. That's what they pay.
Yeah.
Who actually chases the funds?
We have a company that collects for us.
Okay.
billing company that they actually do the billing. We submit electronically all a week's worth of rent sheets to them, and then they bill the insurance companies, and they keep track of every, all the collections come through them into the treasurer's office here into a separate account.
Okay.
Um,
And they take a cut out of whatever they're billing.
We just redid the contract with them it's on a January schedule, and it's 3.75% of what they collect is what they get.
Okay.
And they collect pretty much all of it.
Yeah, they're over 90%.
Yeah.
The last time we checked, they were like
Good.
92% of collection, which is,
Really good.
nobody really does it better than that. And we also have a collection company. After stuff is 180 days old, it goes to Action Collection Agency, but we don't see anything from them. I mean, when the billing company plays it out, it's played out. We don't.
Yeah.
They do a really good job. Can't see enough good things about them, because we had a different company before, and it was a nightmare.
Good.
We'll move on to the budget then? Or, sorry, any other questions on the capital? No?
This is why you budgeted an hour for the fire department.
Yeah, I'm sorry. I talk a
Oh,
lot.
stop.
Well,
Sorry, I left.
I mean, like Chris's question, I mean, this is perfect time to ask questions like that, to be honest.
Yep.
All right,
I
so,
mean,
please.
The call pay line item pays for the call department. So that $44,079 pays for when they come to calls and when they go to training. So all of their money comes out of that line item. And right now, last year it was good. This year it's right on the 50% mark halfway through the year. We've been very, very busy. There's about 30 call people. You don't know how many of them are going to show up at any given time. It's like tonight they're training. It's not a huge crowd, but it could be all 30 of them. You don't know. So, but that's been pretty sufficient to fund that. So I added the 2% increase into that. I was told to add 2% into my admin.
See, he listened to the meetings.
We vetted that out through the earlier meetings.
Okay.
It happens.
Well, that's what I was told to do, so that's what I did.
Okay.
Salaries, all I did was adjust for the contractual increases and any additional stipends and longevity increases that the guys are going to get in the contract. The overtime, if you look at, you kind of have to look at how I do my budget. If you look at the page that has everyone's salary on it and their stipends and, weekly rate, then I kind of start with that. And then what I get from that is I get an average overtime rate, because I don't know who's going to be working the overtime. When there's a disparity in, having the newest firefighter and the oldest captain, there's quite a large disparity in pay. So I use an average rate, and then I go, and the next sheet is my overtime summary, next page. And what I do is I take all the stuff that's mandated in the contract for overtime. Vacation, sick time, I do an average. I did a 5-year average of sick time, and that's blown out of the water this year, because I've had a guy out since the middle of September on sick leave, and he's going to probably be out for another 3 or 4 months. He had an arm injury that had that surgery, so I actually have call department members filling that position on a temporary basis. So we're not paying overtime every shift for that. But that's still going to be higher than expected, than the $800. And then if they don't use their sick time, they get what they call incentive days. So every 4 months that they go without using a sick day, they get a day off. So I have to account for that, and that's an average over so many years. The injured on duty does not cost us anything, because we have if they're injured on duty, we have an insurance policy that it doesn't cover the whole salary. It covers $1,000 a week, but it almost covers it.
And that goes up to $100,000 total, right?
Yep.
And then it picks up one,
And,
we pick up
yeah.
under 100.
Yes, the town, there's no insurance for firefighters in the Commonwealth, so there's a state law that covers them. It's Chapter 48, 111F, and basically it's very simple language. They get paid the same as if they were working. everything, holiday pay, anything
Yeah.
that they would have
Right.
gotten if they were working, they get 100% until they're back. So we do have a policy that covers that. Pauline can tell you, we collected on that policy there 4 years ago, I think it was. When Lieutenant Bozick was out, he was out on 111F, and the insurance company wouldn't pick up there was 2 separate injuries, and the insurance company wouldn't pick the second one up. It was related to the first injury. The town sued them, and we ended up with a $52,000 judgment, because it ended up being 52 weeks, and we
Yeah.
got the,
We got all of it,
We
plus
got all.
85% of our legal fees.
that's right.
Nice.
Yep, good job.
Thank you.
Sometimes they're summoned to court to testify, so they get paid time and a half when they have to go to court. There's a lot of, it's usually an OUI case that they have to go testify for, but there's been other things too. They're in with the police doing things, and they see stuff, so they're always summoned to court. The military leave, I have a guy that is in the military, in the reserves. He's actually activated right now. He's away on active duty. But on his regular monthly drills, I have to fill that position. He doesn't get paid to go, but I have to pay somebody time and a half, so, I include that half time in there. Required training courses that they take, I have in there, mandated by the contract. I have a mechanic in-house that he used to be able to do it while he was working, but we're so busy now, you just can't do it. You can't drop the oil out of the truck and then go out and ambulance call. It's just, so I have him come in on his off-duty time to do that. Officers' meetings, I pay the guys to come back once a month. I pay 3 of the members, one's always working, to come back to an officers' meeting. We have to go to EMS directors' meetings, so the EMS director has to go to a meeting once a month at the hospital, and it's usually a couple hours. Yeah. And then fire prevention investigation, I really don't have any money in the budget for, even though we still do it.
Yeah, we do it.
It just comes out of regular overtime budget. Years ago, I had to drop that out of there, but if you look at it, the mandatory stuff that's in the contract accounts for 97.58% of that money. So it's all stuff that I have to pay out. And it's all to keep.
5.8.
Yeah, 97.58% of it. So, and that's to keep the coverage up. We're mandated in the contract to have 3 people on duty 24/7. So when somebody's out, somebody's in. I gotta go back to my budget now, my line items, I guess, if I could find it. I would escape
Chief, but before you move off of the overtime budget, would having an additional person for each shift impact this
It would
positively?
if the town bargains with the union to still have 3 people on duty, yes, it would. Yeah. So if somebody was out on vacation, that you wouldn't fill that shift. But it kind of defeats the purpose of having that extra guy, because there's so much vacation, because the people that are there have been there for so long. They all have the maximum amount of vacation time, except for the two of them, the new guy and the
Well, the 4
and the
new
second.
people we're gaming for wouldn't have any of
Yeah, they do. They've been there over 10 years.
No.
No, the 4 new
Oh,
ones
oh,
that want to
oh,
hire.
If you put 4 on, it'd be 2.
Yeah, I thought that the last time we hired 4, but yeah, they.
Yeah, they wouldn't be. They'd start at step 1.
They'd start at
Yeah,
step
just
one.
like the latest.
Yeah.
Yeah.
Yeah. But you still have a lot of vacation time to cover, so it almost defeats the purpose for it. Then you still have at 3, but you're not paying overtime. So it really doesn't, it helps your budget, but it doesn't really help your manpower. If the goal is to get more people there, then you're defeating the purpose by not filling that shift.
Question, just skipping down to the services line item.
Okay.
$5,000 increase for vehicle maintenance. Is that any impact on the overtime, or is that just
No,
additional
that's
cost?
just the cost for repairing the trucks, because, this year I went for $12,000 reserve fund transfer already, very early in the year. And those trucks are getting older every year, and they cost more to repair. And you can't fathom what it costs to fix those things. And, what's the alternative?
Yeah.
You have to
They
have
have
them
to
done
have
it.
it, yeah.
Yeah,
And
no,
believe me,
absolutely.
we search out if it's something that can be done
In-house, yeah.
in-house or somewhere that's a little bit cheaper. We found a guy in Leominster that can do some of this stuff, and he's always cheaper than everybody else and closer. We do it. I mean, but I just, I just picked that amount. God knows it's a crapshoot.
Okay.
Yeah.
And then
Looks
the
like you're right.
supplies line, the $9,500, that's the split between the IT,
Yes.
sorry,
That's the boat
the relay
and
and then the boat.
Yeah, and then,
Okay.
I mean, if that's in Cindy's budget.
All right,
she had
yeah,
the
well,
exact
I'll
same
clean it
amount
up
of
in
money,
one- okay.
I think that's something that we really need, so I don't care where
Yeah.
money comes from. as long as
Okay.
that- Other charges and expenses, I increased, in the budget, there was an increase in the educational reimbursement. So that's what that $1,300 for added educational expense.
Okay. And that was part of the contract?
That's contract related, yep.
Thank you.
Yeah, and there was some extra money in that, in the supplies for clothing, additional clothing allowance. I think they give them an extra $50 a year. So that's an extra $650 in the
Okay.
clothing allowance too. That's the only thing I increased it for, was stuff that's actually in the contract.
Okay,
They have to
great.
pay.
Any other questions on the fire budget?
Buried over my one-time purchases. The emergency management budget, the
That's the one I
first,
couldn't find.
That's it.
the first line is salary line for me as the emergency management director, and I had added 2% to that, as I was told to. And the services line item pays for the Code Red, basically. The Code Red subscription is like $4,300 a year, and then the rest of that is used for, like this year, we're going to buy a weather station for basically for the town. So we're trying to become a storm-ready community,
Okay.
and that's one of the criteria is that you have to have a weather station in your town that can be, it'd actually be handy for you guys because it's going to be on the internet. So you'll be able to go to the internet and
Nice.
look up the page for the weather station and see what, how much rain did we get, or, and that,
That's
it's
cool.
important for that, us to track that stuff too, because in all these FEMA incidents, like when we had the big snowstorm, that time that we got money for, like 50 grand back for plowing in that snowstorm. You have to have all the information on the snow totals and
Yeah.
stuff like that, and you have to have a record of it to submit with your, with your
Okay.
paperwork.
Oh, that's great.
So I know Dan had to really scramble around to get that when we submitted. So it'd be nice to have all that information there.
Okay.
And which line item is the weather station coming out of?
It's gonna come out of the services.
Services, that's what I thought.
Yeah, but I think I have enough money in this year's budget to do it, so next year will be for, if we need more to maintain it or anything else for the storm ready community, we're gonna do it.
Great.
Supplies are just, the things we buy with that are sandbags, things to fill sandbags,
Yeah.
all that kind of stuff, and emergency management stuff, generators.
Is that still an adequate amount?
I think it is.
With everything you
I really
have in
do.
there?
I
Right,
think we've
slightly.
gotten so much stuff from the federal government over the last 5-6 years. I mean, we don't have room for any more generators or any more pumps or any more
Okay.
sump pumps.
Yeah, we're pretty
I mean,
well, we're in really good
we're
shape.
pretty
Good.
well stocked up.
Yeah, because of grants and
You know,
stuff,
a
yeah.
couple of good storms, the things break and,
Yeah.
yeah, so I mean, you still need to keep some money in there for maintenance and stuff. Because they give you the stuff, but they don't fix it for you.
See, these guys
Never go
get
anywhere.
that.
Quiet, very quiet.
That's been there half a dozen times today.
No, it's been brutal today. I don't know what the issue is.
Fell down early this morning, like at 15. Fire alarm doesn't
Yeah, up there. You can stay, Jeremy's there.
All right. Do you want to jump to the, we're almost out of time, the ambulance enterprise?
Yep.
Walk us through that.
That's kind of
That'd be great.
back. There's another sheet in there just with salary. So the ambulance enterprise is in pretty small print.
Did Lisa do this?
Yeah,
That's
we
why.
did together, yeah. Yeah, I don't, she squints a lot.
But she can look at it on her laptop, it's a lot better.
You have to mention rap text to her. Expands the
Yeah.
cell.
I know. So the very top line item, the 415,700 is what I'm estimating that we're gonna bring in this year. She had a different total in the general ledger account than, I mean, I track every month when we get a report from the billing company, and I track that because it breaks down into 3 categories, and I like to track the ALS, BLS, and the ALS intercept, so I know where the
Yeah.
money's coming from. And evidently, there was a transfer made at the end of last year that started this year's off. So she has more money, which is fine with me, in her general ledger than what I have for the budget. But and actually, she did the first 5 months of what my actual was, and when the 6 months came in, it was way larger than. We just started up that new ambulance program. I think there was a little bit of a lag. Yeah, and that kicked in the last month, so actually my projection is up over 400, so it's actually gonna be more than that. And we've also applied for this program through it's federally funded, but the estate has to adopt the program. If you can prove that Medicare doesn't meet your costs, Medicare and Mass Health, then there was like a 7-page spreadsheet that we had to fill out to. Yeah, it was brutal, but she did it. She stayed here late one night to finish it because we had a deadline we had to get in. And we could get $30,000, $40,000 back out of that if the members that we submitted are, vetted through their program, which I think they will be. They use 10% for an indirect cost reimbursement, but we proved to them that we use 25%. So we just got that paperwork into them yesterday, so we're hoping that.
So that's designed to
And that'll be
augment the
Yes,
ambulance
and that'll,
charges
yeah.
from Medicare.
Yeah, and it's kind of funny because I talked to a lot of chiefs that run ambulances, and they're like, we didn't do that, it's too high. Really? Yeah, I'm gonna try and get back more money, but I don't think they have the level of cooperation with their accountant that we have,
Right.
To get these things done. Because I wouldn't have been able to do it on my own. There's just absolutely no way. It was accounting stuff.
Substantial money.
Yeah, I mean, I could do the numbers part of it, that's my numbers, but she had to do the rest. So I think we're gonna bring a little more in than that. And you can see that we're using $40,328 out of the subsidy in the account to make up this budget, but I really don't think that all that'll be used because of we're gonna bring more money in, than what I'm estimating. So yeah, direct expenses is supplies, and that's been the same for the last 4 years, and it's enough. And if we don't use it, it just rolls back into the enterprise fund. You're gonna see a big increase in the services line item from 42,650 last year, up to 48,278, and there's 2 things that are driving that. Cardiac monitors that are in both ambulances, and we have these things called Lucas machines that do automatic CPR. They actually do the compressions for you. Well, we're required to have maintenance agreements on those.
Okay.
And for Lucas, we had 2 of them, and we got a new Lucas through a grant last year, and it came with a 1-year maintenance. So we're picking up, this is the next year of the Lucas contract. And we just bought a LifePak 15 out of last year's budget. We purchased a LifePak 15, and the maintenance cost on that is more than the LifePak 12 we had, so there's an increase in
Which is a
that.
cardiac monitor.
Yeah, it's the cardiac monitor that goes on, and we're required by the state to have contracts on those things. So if the cardiac monitor breaks, the company brings us a new one to use while they're fixing the old one. Same thing with the Lucas machine. And then the other increase on that is for the ambulance reporting software that we bought last year. The first year of the maintenance was included on that too. and that's $42.70, I think it was. Very best page in there, I don't see it. But anyway, it's just those two things. Yeah, it was $41.75 for the ambulance reporting software and $3,449 for the increase in the service contracts for the monitor and the Lucas.
Okay.
So that's the increase. That's the only increases, ones that I actually have to have. There's an operating reserve fund in there. The first year I took over as chief, we ran short in the budget, and I had to go for a reserve fund transfer, and it didn't make any sense to me at all that it was coming out of the general fund. And then I found out through the ambulance enterprise thing that you could have a reserve fund in the ambulance operating budget. So that's why Lisa and I started at 10,000. We've never had to use it since that time, but it's in there. It just rolls back into the fund.
Nice.
But I would assume you'd still have to come before the finance committee and the board of selectmen to use that money. But it just keeps it in the account. So. That's interest and bond administration is that $18,000. That's for the new ambulance and the cardiac monitor that we bought last year. And then, I think the regular debt is the other one. I don't know. Lisa knows more about what that covers than I do.
Okay, no, that's fine.
Those are the two things that she does. So
I
the total,
presume the increase in the regular debt is for the new ambulance purchase.
yeah. So there's $119,872 is direct expenses. And then the indirect expenses, I think we touched on that before. That's 25% of the firefighter salaries, 15% of mine, 33% of the admin. That comes to $336,156, and that money goes monthly back into the general fund.
Okay.
So that reimburses the general fund for the salaries. They're all budgeted in the fire department budget, and then they go back in. This one's the hardest one to figure out, and it's all because of the hospital stuff that they do. It really is. Or the state. The state can just come in and say, you have to do this now, and then you have to do it. And those are the two
But it
things.
still operates in the black.
Yeah, it still does. We've never had a subsidy from the town, right? Yeah, and I don't know when the enterprise fund was, created, but it's gotta be, I mean, I've been 9 years. This is my 9th budget. So it was at least 4 or 5 before that, so it's always operating in the black.
Okay.
Great.
All right. Awesome. Any other questions about anything required? No? I'll say what John always says, that he's not here tonight. The amount of detail and effort you put into your budget, you and Chief Murray, it's fantastic. It really is. Makes it so much easier sitting on this side of the table to understand things.
Yeah, well, I mean,
Highly
you kinda have
appreciated.
to- Kinda have
Yeah.
to, if you wanna know,
Yeah.
where it goes, you gotta track
Yeah.
it.
So thank you very much. Appreciate
No,
it.
thanks for the good questions too.
Our pleasure.
You know, yeah, I would rather have somebody ask me a question, than have them wondering about it and start talking about it, If you have a question, ask me.
Awesome. Thank you both. Have a good evening. Thanks.
You have a quiet one.
You gotta go, go? Okay. We still have quorum if you need to go. What's that? No, you can go if you have to leave.
See you tomorrow.
Yeah. So we'll discuss it real quick after. So I'm gonna try to reschedule as many from last night on this coming Wednesday. So hopefully, I'm gonna try and see if we can do it, even if it eats up most of the meeting on Wednesday. We don't have to meet. We don't have to have an extra meeting. So thanks for coming. Have a good night.
Library's way at the end. You can
Okay.
find it by looking for the page that's turned down like that.
Oh,
There
All
you
right.
go.
You
And
all right
then
driving
there's
home?
a whole lot after
you
it.
all right driving home?
It runs up until
What's that?
this date.
Okay.
Yes, it is.
I don't know who this belongs to. Because they didn't sign it until we get to the budget page.
Let's see,
Park department.
Oh,
find everything?
You got it?
All right. So next up, we have the library. We're ready for you whenever you are. Ms. Licht, how are you this evening? As many people as want can come up. It's fine.
No, Deb, you stayed here through Bob's. I think you should stay here through.
no.
No, he doesn't need to, or no, it's just as well?
I don't think he wants me here.
Now. And how come you're not in Aruba, sir?
Huh?
How come you didn't get invited to go to Aruba?
Because I
sir?
didn't get invited. Story of my life.
Eloise, how are you? Doing well, thanks.
Give you all a copy of the budget. Something I will look at.
Well, I have one, but it's at home.
Pauline.
Hello, Marianne, how
You
are
okay?
you? Happy New Year.
Remember your name?
Thank you. Is this the same that
You know
was
what?
It's
submitted?
same.
You can have an
Okay,
extra copy
great.
because this is in our.
Oh, you're gonna have it already?
Yeah.
Yeah, thanks.
Okay.
Thank you. I wasn't sure it had.
The boat coming back for the girl that fell? And give the boat coming back for the, but you're going to do that for a couple hours a day.
Alright, let's see.
You know,
Okay.
So thanks for coming this evening. Appreciate it. I guess what we'll ask you to do is kind of walk us through your budget for next year, what you're looking for. Any questions or concerns you have about that is greatly appreciated. Anything you have for FY15, since we're at the table, if there's anything in this fiscal year you think you have some concerns over that, not being able to meet within your current budget, feel free to bring that up also.
Okay.
Okay, so I'll turn it over to you to begin the
Okay.
conversation.
I feel good about this year. We haven't had any issues up to this point. We're halfway through. We've had some issues with, unfortunate issues with staff. I think you're all mostly filled in on that. Two of our important sort of supervisory staff members have been out for the past couple of months, so that's put a little bit of extra pressure on everyone else. One ill with pneumonia, and a very serious case, and that's Julie Lacey. And then we actually had an accident, a very unfortunate accident at the library, in which the children's librarian fell down the stairs at the library and fractured her skull. And so she's been out for 2 months. So they've both been out for 2 months, both planning on coming back on a part-time basis in February to see how there's some residual effects of the concussion and the fracture for Amy. And Julie Lacey had actually life-threatening pneumonia and is coming back in February. I think she'd like to, if a doctor, I get a doctor's release, that she can come back just on a part-time basis to see if she can get that stamina back she lost when she was in the hospital. So it's been kind of a trying winter in that respect. But on the other hand, everyone has, come to the plate that works at the library, and I've seen some things out of people that I probably never would have seen if those unfortunate accidents and illnesses hadn't happened. And so we're going along pretty well. The building is holding up, the heat is working fine, so I don't foresee that this budget won't take us through unless, of course, any unforeseen thing can happen, but I don't project that. As far as the budget goes for FY16, as you know, we did ask for some capital improvements for the building. The replacement of doors was one of them, and some repainting of the library was the other one. That's the capital. As far as the budget appropriation goes, The only change really is in two areas. One area is in the salary area where we increase the staff at the request of the trustees at 2% for each staff member. And I'm consolidating one of our children's staff, Christina Zoller, you can see there, 19 hours. I'm consolidating her position with a tech position that we never did fill, that really she has the skill set I'm looking for. Her, Christina and Samantha Benoit both have the technical skills that we need at the library. So Christina is such a valued employee now that she's been trained for almost 2 years at the library, that and she's taken over the children's department now for the past 2 months, and this is sort of what I'm talking about. She's taken on so much responsibility in planning of programs and working with parents, and just so many ordering materials and doing all the work that someone that has a totally different profile and skill set has than what she is doing right now. So I have, with the trustees' permission, of course, consolidated her, I'm going to give her a new position, and she will be an assistant to the children's librarian with more hours and an increase in her hourly wage. So that's one of the big items in the budget, and along with the 2% increase for the other individuals. And the increase in the, everything else is level funded. We reduced the cost on one line. Let me go down there real quick and see if I can find that. I thought I had reduced something. Maybe I'm mistaken on that. Books increased. When the overall budget increases, even the salary into the budget, the total of the budget, 19% of that has to be spent on books and materials. Now, books are not only hardcover books, but e-books, books on CD, movies. We can pay for museum passes now out of that allotment, which is something new. So now we have all the museum passes to all the different museums. And those are the two areas of increase, really.
Excuse me.
Paul?
No, I just want to say that the book budget also includes periodicals.
Oh, yes.
All of the daily things that people come in the library looking for all the time.
Yeah.
Okay.
So it does include that also. It's in the book budget, we can take that out.
Yeah.
So
Yeah.
we're not just buying, like as Mary Ann said, we're not buying $90,000 worth of books, it's books on tape and
Right.
all the other things.
There's so many different
Okay.
There's
varieties.
just so many different varieties of reading materials that.
Even
Yeah, does that include like the data, the services, like consumer reports and everything
Yes.
else?
Right,
that you offer?
oh
Yes.
yeah, and
Yes.
anything actually that people look for.
all the databases.
If
And,
anyone's looking
Yeah.
for something, matter of fact, we had a request a few years ago for Barron's, which is a financial, which has since gone away, but I mean, if
Yeah.
someone was looking for something like that,
Okay.
we can get a subscription for that.
Great.
yeah, so there's a lot of different aspects of that. It's figure 92,000. Is it? What is it? $94,000 this year. Not just hardcover books and paperbacks. I mean, it's a very broad spectrum of materials now in libraries that come under that budget line.
But as Mary Ann had said, that is a mandate for state certification.
Correct.
Our budget
Yeah.
increases by a multiplier every year, plus that out of that total budget, we spend 19% on books and other reading materials. So the number that is here is not voluntary, this number adds up because of the 19% of the total budget is that amount of money. And we do that, again, to keep that certification, along with the hours.
What is the percentage for recertification?
19%.
No, sorry, I'm sorry, the overall budget increase? for state,
It's a
like-
multiplier of, and I'm
it's the
sorry, I
average
don't
of the
remember, it's
last
1
3
point,
years, right?
it
Something
stays the
like that.
same. I'm sorry, go
No,
ahead.
it's what you do is you take the last 3 years
Yeah,
and the average of the last 3 years
okay.
and divide that, well, you get that average and then you multiply it by 1.025.
Right.
And that's not percentage, that's a multiplier,
That's right, yeah.
Yeah.
right?
Yeah.
Yeah.
So you
That's
take
what
the
it is.
years.
I thought I gave you that.
Okay.
Would
They
you,
should, they
I-
What?
that's
It's on
what
the
here.
back, that's what it is.
I just want to ask, I mean, I'm aware of that, I just always like to
Oh,
ask
okay.
that question,
Okay.
just in case anyone
That
watch,
hasn't
especially
changed.
people,
Yeah.
because we have such a large fan base who probably watches our videos at home, just so
Yeah.
they know.
And we have a huge amount of patrons that come in for the movies, the DVDs, and now it's the television series that it's on PBS and
Mhm.
is Stars and HBO and
Netflix.
all of that people can't afford, don't choose to have, whatever reason. We buy a lot of those series. Of course, we can't buy all of them, but we buy a lot of them. And everything from Supernatural to Breaking Bad to Romanovs and, just it goes from everything. We even have Welcome Back, Kotter.
Oh.
Yeah, I mean, even some of the old TV shows like that, now people, and they're taking them out,
Yeah.
so, and those don't cost hardly anything. But, and of course, Downton Abbey.
Got
you
it
know.
down to Abbey.
Oh,
We also, out of that book budget, we put a lot of money back into our internet, or into our books on demand for the online. I'm sorry, I can't
Oh,
remember.
the ebooks.
The
Oh,
ebooks.
yes, yeah.
We actually can put money into that program, and those books become earmarked for Ayer library users only.
We have something at the library. You can get on the library website with your library card, as you probably know, Scott, and you can download Whisperjet, a book, through Overdrive and CW Mars to your reader, your Kindle or your Nook. I like Kindle better than Nook, but, regardless, either one. Or your iPad or iPhone. We went further than that. We bought into Overdrive Advantage. When you buy into Overdrive Advantage, all the books I'm ordering on that are, anyone in the whole library community of 160 libraries in CW Mars can get that book, but it's always available to a person from Ayer with the Ayer library card.
Okay.
Because we
Okay.
pay into that service.
Yes, it's
Yeah.
a special service that, I spend, $2,000 or $3,000 on, because I was just kind of, getting my feet wet in
Yeah.
it and seeing how it went. And instead of going on hold for a book, like you have to for ebooks when you get online, if you find a book, Overdrive Advantage, you can tell it's for Ayer because there's a little symbol on it that you will recognize after a while. And you can just get that book right away. You don't have to wait for it. There's no hold on it.
That's
If it's an
great.
Ayer library card, you get it.
Yeah.
We just wanted to bring that up because it is money
Yeah.
that's going in
It is.
from the book budget that goes right into
Yeah.
Advantage, and it's earmarked specifically for Ayer library
No, that's
users.
great.
And I don't know.
And that will become, I'm sorry to interrupt, but that'll become a bigger part of the book budget over the years, because the ebooks is
Right.
becoming such a popular item.
And I am
I still like a good
almost
paperback
totally.
myself.
Do you read ebooks?
What's that?
Are you an ebook fan?
No, I'm not an ebook fan.
Oh, I'm all about
Can't
ebooks.
can't stare at the screen for that long.
I'm
Yeah.
all
I'm
about
kind of like you, I'm a hard book
Oh
guy.
my
but,
God.
Yeah, I prefer.
I'm an absolute hard book, but a
Yeah.
lot of people are. These ebooks
Yeah.
they're taking off.
Oh,
And that's why we have to get on this
Yeah,
advantage program.
yeah, it's just keeping
Yeah,
up
no,
with the
you're right.
times and
You're
your
right.
customer base.
I
It's
love them.
it's
Well, they should
great.
keep, you're absolutely right. Keep, if they don't get them from us, they'll get them somewhere else.
Yeah,
Well, you know, I need to, the large print on an ebook is fabulous.
True,
The-
I don't have
the-
to wear my glasses when I'm
The
on my
lighted,
Kindle.
the
yeah.
lighted back screen, I mean,
Yeah.
when you're older, a
Yeah.
little bit older, and you wanna read at night, you don't have to have, lights like this on. There's so many advantages, I just absolutely think they're fantastic. But I wouldn't wanna have to buy, my ebooks from Amazon, because I couldn't afford to.
But I'm such a hard book fan, I just bought 3 copies of the Menino book.
Oh,
Wow,
really?
Yeah, I don't know why I
Wow.
needed 3.
yeah.
Blow me one.
Well, we just bought 2, so you're one ahead of
I should
us.
probably give you one of the other ones, because actually I was gonna give it as a gift.
Well, books
maybe
like
more.
that, there are books that we buy doubles on. There are certain books that just, people want them, they fly out of the library. We always keep, even though we're obliged through our contract with CW Myers and all these other libraries in our consortium to loan books to any of these libraries. There's a 3-month period in which we keep the new books for our Ayer
Patrons. Yeah,
patrons,
Sure, right.
and then we have to sort of do a little reprocessing on them, and then they go out to other communities, and sometimes they're gone for as long as 3 months. That's just the way it is with this whole system.
yeah.
We have the van every single day through CW Mars, and we get in probably 50, 60 books a day, and we send out probably 60 to 100 books a day.
Really?
So
We're a net lender. We have been for years.
yeah,
We loan out more books than we take in.
it's a whole process that we have to do every
Yeah.
morning, first thing when we get in there. So that's why we go in always an hour before we open, so we can get all that whole process done. So it's been, with 2 less people, it's been, really, but
Yeah.
it's been okay. It's been okay, as long as no one gets what I have. And it's spread around. So
Everybody starts
basically,
coughing.
that's the deal, the increase in the salaries and the increase in the book budget. And it has increased our bottom line by, what did you say, Debbie? Debbie had that.
24,000 and change, or 23,000
Yeah, right
and
here.
change.
It's
3.89%.
496 from 478.
Okay,
Yeah.
that's what the budget increases.
So 890.
So I have 2 questions on the salary section.
Yes,
I know, so looking at the shift for the assistant children's librarian, that increases, that's a net increase of about $10,000. And last year you were talking about hiring a part-time children's librarian. Does that does that supersede that?
yes,
Okay, it does.
yes.
All right. And the other question was, which I think has come up every year I've been on this committee, is are you retiring this year?
I was wondering
hope
the
so.
same thing.
My
Wow.
husband's down there.
He paid me nothing to ask that,
He didn't slip you one out?
but this is my 5th budget cycle and it's come up to the previous 4. Just a curiosity question. You don't have to answer that. Just wanted to put you on the spot.
My lips are sealed.
Okay.
I could keep going until I was,
100.
hopefully.
You stay as long as you want.
That's right. This is
Don't
my
tell her that.
30th, Colleen, this is my 30th year at the Ayer Library.
Yes, because say you
Really?
were here when I moved here, and I've been here almost.
This is my
30 years.
30th
No kidding.
year.
Wow.
I started in 1985.
Yeah, I got
Oh.
here in 88, yeah.
Yeah. So,
I don't say where I was in 1985.
oh, you were in 7th grade. Stop it.
Oh, I was in junior high. Thanks.
Somehow I don't think so.
Go
So
away.
that's the budget, that's what we hope, that's what we're,
Okay.
the trustees, and myself, think we could do the best job possible for the library, for the community. We've been trying to be much more active in the adult, area as far as programming goes, offering programs to adults, trying to get them in the library that way. bringing special speakers in, the townwide reading. I don't know what we're going to do this year. I'm so tempted to do American Sniper, but I don't think I'll be able to because it's too new.
I actually read that. It was a good book.
Loved it
was,
so much.
Yeah, it was very interesting. It wasn't the best written book, but it was
Right.
incredibly interesting.
I know.
Yeah, it was a
it's,
quick.
it's so new and so many people have
Yeah.
read it. But I just saw the movie and I was so, I read the book, I saw the movie, but I will pick something that I think has equal appeal to men and women and is timely yet not written this year or so
Mhm.
because too many people will have read it. So I'm going to pick something that I think is, it's a program it's popular.
You want to know what my favorite book of all time is? And I don't know what made me think of it just the other day. I cannot remember the author's name, but you may know. It's a book called The Shell Seekers.
Oh, the Shell Seekers.
It's got to be at least 20 years old.
Oh, yes, and I can't think of the author's name either.
The first name began with an R, I think, but oh my God, and it's fiction. It's not even
Yeah.
a real, somebody just sat down and wrote it, but
And I think it's a prolific author too, but
it's a beautiful, beautiful
I
book.
can't think of the name of the author. Yeah.
Okay, well, I need to get
Probably the
home
last
soon
book
I've
before I
read.
collapse. So, any other
Okay.
questions regarding the budget?
If anyone.
Sorry, I apologize. It's been a long month so far.
This has been the
I know,
longest
Paula.
meeting too.
Yeah.
Yeah, okay.
Not because of you, that's it.
Everybody else set?
I think we're all set. Thank you very much. I just want to say that the services that the library provides is excellent, so thank you very much.
Thank you.
Appreciate it. Thanks for everyone who came. Thank you.
And I have. Thank you.
I don't know why I keep taking these things off. Because I can't see
Wishful
it.
thinking.
I can't see a thing without.
I do. I realize how blind I am.
Okay, so just one quick thing before we adjourn. I do want to get everyone's opinion about trying to reschedule everyone from last night's meeting, which was missed because of my boneheadedness.
Technical error, don't worry about it. I'm just glad I noticed it before I came over
Yeah,
here.
I just,
Oh,
right upstairs.
because I can't check the email during the day.
So I'm going to try and see if we can reschedule everyone for Wednesday. I'm going to push the treasurer. We had scheduled for an hour. I think I'm just going to give her half an hour. I know Board of Health. Pam said she only needs like 15 minutes or so for Board of Health. So I think if we schedule everything out on Wednesday, if everyone's available, we can do that. We will have to go over also capital planning. We'll have its recommendations at that point. John wants to give us a debrief on that. And we'll have preliminary school budget numbers at that point also.
Do you want to, I was planning to have all the minutes from the budget sessions that night. Do you want to just postpone it to the following?
Yeah, let's
regular?
postpone it off.
Okay.
The first meeting in February will be the big catch-up meeting. We also want to start looking at the Devon's proposals, just to kind of vet that as a committee. So
So
I'll-
that'll save me a little.
yeah, that's fine. And there's no, I mean, as long as you get them done within like the next month or so, it's fine.
Well, I want to have them before we revisit with anybody too.
Okay,
Not that they're that stellar, but.
or something. Still matters. So next meeting is budget meeting tomorrow night, 7 o'clock. We have Department of Public Works and Administration. It could be another longer one. Then the next scheduled FinCom meeting is the 28th, next Wednesday. And it'll open up just if you guys have anything to share.
When's the next meeting after the 28th?
It will end up being, I looked at it today and I'm drawing a blank on it.
We definitely should have a calendar in this room, or at least up
It
there.
would be nice.
Well,
Thank you for coming.
it's coming, the calendar.
The 11th of February.
Okay, so I'll have the minutes for then, and
Okay.
I'll send them along before, once I get them done.
That's perfect. And with that, if there's nothing else, I will take a motion to adjourn.
I was just going to
Sorry.
ask, is that for distribution?
Yes, this is for distribution. Sorry, Mr. Marr dropped these off. If you want to take one, these are the packets that he hands
That
out
he
to
mentioned,
businesses.
right.
Yeah, for business and industry. I think I haven't looked through yet, but I think the cover looks great.
I don't know who does this, but they do a fabulous job. I think David may have something to do with it.
Yeah.
It's
So I'll take the other ones to hand to Chris and John tomorrow night.
Adjourn 8:40 something.
Do I have a motion for that?
I move that we adjourn at 8:46 and a half. 8:45.
Oh, well, all right, was 8:46 or 8:45?
Mary Ann said it was 8:45.
phone says
I would
8:45.
I would trust
All
the.
right, 8:45, I have a
before that.
motion to adjourn. At this rate, we're never getting out of here. Do I have a second?
Seconded.
All those in favor say aye.
Aye.